Welcome back to Navigating Cancer. I'm Dr. Joey Bennett along with Wendy Hall, and we have spent today's first two segments talking about exercise. Which is something that we both need to be doing more of, and I think we need to push each other. We'll start to do that and see if we can't do it. In the first couple of segments, we were talking about the impact that it had on your risk of cancer. I want to talk a little bit about survivors now, because on this slide you can see that there have been so many improvements that we now have 11, almost 12 million cancer survivors in the United States alone, and that number is going to go up. At the same time, the biggest epidemic that we have in this country right now is obesity. And all of a sudden we're going to find out, studies are showing that obesity increases your chance of the cancer coming back and dying from a cancer by about 50%. So it is a significant risk. Despite the fact that we know these things, the great majority of cancer survivors are not participating in any kind of regular physical activity. So I know that at least in our practice, we're starting to really kind of push our patients to remain active and to exercise. We don't really know why a lot of times patients will decrease their exercise after the treatment is done. I think it becomes hard for them to exercise during the treatment because of the problems with all the appointments and everything they have. And then once they finish the treatment, they don't necessarily jump back into what their routine used to be.
Right, that's correct.
And it's really just trying to get them back into their routine. We know that women who have breast cancer who exercise on a regular basis will do much better than those who don't exercise on a regular basis. And if you read this one, it says the handle on your recliner does not qualify as an exercise machine. So this is not sitting and watching television. This is truly getting out and doing some form of exercise. And so we have some specific recommendations for our patients. The goal here is to try to preserve and possibly improve your body function, how you feel. But again, as I said before, it's got to be individualized to every person. Talk to your primary care physician, find out what you can do safely, and then try to make that exercise an integral daily part of your life. And if you'll get into a habit of doing that, you're going to feel much better, your energy level is going to be better, and studies are showing that your chances of surviving your cancer are also going to be much better. And this slide kind of drives that home. 30 to 50% of breast cancer deaths in women who have gone through menopause can be attributed to the fact that they are overweight. And when you look at cancer survivors, they tend to die of non-cancer causes at a higher rate than other people in the general population, meaning heart disease, diabetes, and things of this nature. So if you sit here and you're diagnosed with a cancer, and we're fortunate enough to cure that cancer, and then all of a sudden you just become a couch potato, you're just really shortening your life expectancy significantly. So it's critical to try to get out and be active. Things to keep in mind, though, and this goes back to talking to your oncologist, talking to your primary care physician. Are you immunocompromised? Is your immune system down a little bit where you need to be careful outside or around other people? Are you at a risk of bleeding? Are your platelet counts kind of low, or are you on any medications that might make you at an increased risk of bleeding? Last one there, are you at a risk of cardiovascular disorders? Are you at a risk of getting a blood clot? Are you at risk for a heart attack or something like that? It all goes back to talking to your physician, not only your oncologist, but your primary care physician, because primary care physicians know all of the medications that you've been on for years and years. Sometimes new medications are thrown in at the time that you're diagnosed, so it's very important to keep the lines of communication open. Really, you don't want to consider that a diet shake is exercise either. This one says the only diet shake I would recommend is the shake your booty makes when you exercise. So we really want you to try to get out. We've had some at our staff members doing some yoga classes. Right, so we're trying to push not only our patients but our staff as well. We're having a weight loss clinic that's taking place at our facility
which also
now.
Includes the category of exercise.
Has a lot of patients, and it talks about exercise as well. So To kind of summarize where we're coming from here, there are multiple biologic explanations for the benefits of exercise with regards to your risk of ever getting cancer, your reduction of the risk of getting cancer, and your surviving cancer. Exercise and cancer prevention go hand in hand, and we're talking about colon cancer, breast cancer, prostate cancer for sure, and possibly lung cancer and uterine cancer. So if that's not enough to make you think about trying to get into a regular exercise program, because those are the most common cancers that we deal with that are not caused by something that we're doing, like lung cancer and the utilization of tobacco products. So really push yourself to try to get out there and do this. We know now that with regards to exercise and cancer survival, we're going to have more and more people every single year alive in this country who are survivors. And if we're seeing a decrease in physical activity, not only in our survivors, but in our general population, and if we're seeing more obesity, we're going to start dealing with more and more disease problems down the road. And so what is the prescription for exercise? Well, the prescription for your exercise may not be the prescription for me. It may not be the prescription for Wendy. It may not be the prescription for your neighbor. It needs to be individualized. And we talked about the fact that it may be swimming, it may be walking, it may be biking. You may be healthy enough to get on a treadmill or go out and run, but make sure that you're discussing that with your physician. Make sure that your physician understands what your limitations are. Make sure your primary care physician has some input, and make sure you keep it simple. If it's too complicated, you're not going to do it very often. If it requires you loading your bike up and driving over to the rails to trails and then going, you're so complicated that you're probably not going to go and do it that often. Something you can do in your home, in your neighborhood, you're going to tend to do much more often than you will if it requires a lot of effort getting ready for it. I mean, you know, I joke about people who have boats that they don't keep on the water, and they have to trailer it to the water, put it in the water, go out, pull it back up, bring it in and clean it. They use those boats a whole lot less than somebody who lives there. So try to do things close to you and make sure it's individualized just for you. And this little cartoon kind of brings it to a head. What fits your busy schedule better, exercising 1 hour a day or being dead 24 hours a day? This is something that we can do. We can eat right, we can exercise, we can limit alcohol, we can limit tobacco, and by doing all of these things, we can limit our risk of getting cancer, and if we do happen to get a cancer, we can improve our cure rate. So please take that to heart, get out there and exercise. Thank you for joining us, and we hope you'll join us the next time on Navigating Cancer.